Joining me now to talk about the recent uptick in cases and the rapid spread of the Omicron variant is nurse practitioner Alice Benjamin. Thank you so much for being here on this Christmas weekend. We appreciate having you.
Thanks for having me.
So we have seen these lines at these testing sites around city blocks. We've been hearing about all these outbreaks and how contagious this new variant is. So what has it been like to be on the front lines now going into year 3?
Going into year 3 as a healthcare professional, we are definitely still seeing that we're definitely in a pandemic. We still have people testing positive. We still have people being admitted to the hospital. And especially with Omicron, we've started to see a resurgence of people being admitted. We're also starting to see a lot more breakthrough infections. So people who are once fully vaccinated now wondering, why am I positive for COVID? Well, with that waning immunity and with Omicron learning to get around some of our natural and vaccine immunity, we're finding that we cannot let down. We still have to remain very vigilant with precautions to slow the spread.
And are these people who are also boosted?
Actually, anecdotally, I'm not seeing that as much. For the most part, these are people who were early responders to the vaccine. As soon as the vaccine became available, they got on board, they were doing everything they were supposed to do, but yet they haven't had a chance to get boosted. So it's really important, and even the CDC, they're looking at this. What does fully vaccinated really mean? Initially, it was your initial 2 doses of your Moderna or your Pfizer or your Johnson & Johnson, but now getting that booster, we're seeing that people who are boosted are less likely to be reinfected.
And it's cold and flu season now. The temperatures are dropping. People are gathering for the holidays. What is your outlook going into the winter? And then what is your outlook longer term for 2022? I know you're not a soothsayer, but you do have a lot of experience.
Right. So I'm actually in the ER and the ICU, and then I wear another hat at a federal COVID testing site. So I am seeing the front end and the back end of what this virus is doing to people. And I anticipate that coronavirus is going to be with us for quite some time. The one thing, although we are seeing Omicron be very contagious, a spike in rates, what we're seeing is it's causing more mild illness, which is a good thing, which is not causing severe illness and death, but we can't be sure because so many things are changing. So it's going to be very important that people remain diligent, get vaccinated, get your booster, wear your masks that cover your nose and your mouth, stay away 6 feet away from people whom you don't know. Avoid crowds as much as possible, especially in places that are poorly ventilated and it's cold. People are indoors. You're going to need to take precautions. Get tested. That's going to be something that's going to be very, very helpful. Serial testing is going to be helpful with before the event, after the event, to look at exposure. And then it's going to be very important that people honor the honor system. If you do test positive, if you do have symptoms, even if vaccinated, if you've been exposed to someone who has COVID, we need you to limit your activity so you don't spread the virus unknowingly.
What if you've gotten a recent case of COVID, maybe it was a breakthrough case, and you're not allowed to get the booster or another vaccine within a certain time period, right? But are you still able to spread the virus around to others in the interim?
Well, what we do know is that there are such things as asymptomatic spread. So, and literally, I worked last night. We are seeing people who've had COVID, who've still gone and got their full dose of their 2 doses, and then still testing positive. Boosters are going to be very important and critical at helping to prevent people from getting coronavirus. It's still there. You have to take precautions. And as far as spreading it, what we tell people is that once you test positive, you need to be on isolation for at least 10 days. It's that first 10 days of isolation or onset of symptoms is the most critical point of when you are contagious. After that time, provided your symptoms have improved, you don't have fever, you're less likely to be contagious to other people. However, we don't know for 100% sure yet. So you got to wear your mask, physical distance, and do all of those things because even though we know a lot, we're still learning a lot more about the virus with each new strain that we're learning.
And you, as you said, are on the front lines. We thank you so much for your service and all the work that you've been doing, and also thank you for joining us tonight.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.